Because what you don't know about energy can kill you. Here's Alex Epstein.
Welcome to Power Hour. I'm your host, Alex Epstein. Some of you may notice something different, which is that you can actually see me, as well as you can probably see Don Watkins and Stefan Henna. We are doing a video Power Hour for the first time in several years. I hope it's something you like. If it is or if it isn't, let me know at alex@alexepstein.com so I know whether we should do this again. So, well, let me just say hi to you guys. Hey, Don. Hey, Stefan.
Hello.
Hey, everyone.
Don, I haven't seen you in forever. You have a beard now. You look like a guest on the Joe Rogan show.
That's the dream.
Yeah, you're ready to go live in the mountains in this time of forced isolation. Okay, so speaking of forced isolation, the big topic this week is going to continue to be COVID-19, although we'll talk a lot about the different energy aspects of it. So just to give you an arc of what we're going to cover a couple of big points about COVID-19, just that as its own issue and how the thinking about that is and what the policy should be and why we're focusing on it, because we're primarily energy people. And then we'll talk more about the energy implications and the energy policies connected to it. But yeah, I really want to focus a lot on just the policy in general. And so the first segment or the first topic is how bad thinking methods are influencing COVID-19 predictions and policy. And some people have asked, they've seen I've done some TV appearances in the last week. I've been commenting on this. I've been asking a lot of questions on Twitter and Facebook. And sometimes people have legitimately said, hey, why are you focused on this issue? Don't you have stuff in energy to do? There's a lot of stuff in energy to do. And you are not an expert on epidemiology or viruses or infectious diseases more broadly. And that is absolutely true. So why get involved in this? And I think I can boil down my reasons to 3 words, all of which begin with F: flourishing, freedom, and framework. And I think framework will be the most interesting. But just to address flourishing and freedom first, the core idea of my work is this idea of human flourishing, human beings living to their full potential, both their material, physical potential, but also their mental potential. And fundamental precondition of flourishing is freedom. We can only flourish to the extent that we are free to think and then to act on our best thinking. And I have a whole talk, you can look it up on YouTube. It's called The F Word, and it's about how freedom is fundamental to flourishing. And what we're seeing right now in this country is just a tremendous decrease in the amount of flourishing and a tremendous decrease in the amount of freedom that are very, very related. Now, the part of the context for this is a very scary virus, which I'll be talking more about. But as I pointed out in last week's show, and is worth pointing out again, there's been very little concern for the massive decline in freedom involved in these indefinite universal lockdowns, or sometimes I'll call it indefinite universal isolation. There's been very little concern for the deprivation of freedom involved, and then how that lack of freedom has, particularly our freedom to interact with one another, has just completely wrecked the productivity of most people in this country and is just leading to a mass decline in flourishing. And I'll talk more about that. But it's really important that people are not focused on it very much. They're focused on the virus, and that's an important thing to focus on. But the supposed cure for the virus has been so massively destructive, and I don't think that there's been nearly enough concern about that and about the really hundreds of millions of people who are negatively affected by that, who there's a strong argument they themselves wouldn't be all that strongly affected by the virus. We can talk about that. But so there's that flourishing aspect. And then there's the threat of far greater curtailments of freedom going forward, not just indefinite lockdowns, but the government really taking over more and more of our lives, and specifically our economic lives, our right to produce and trade, and more broadly to interact with one another. There's all, and in history, often a crisis precipitates a dramatic government intrusion in our lives and a dramatic decrease in freedom. So I see the moment we're at as a very potentially decisive moment. It is a decisive moment, but a potentially really terrible moment, not just for the suffering now, but for the destruction of freedom going forward. Many people have the narrative that freedom is what has failed, and so more government control is the solution. And I believe that's fundamentally wrong. And certainly anytime that the fundamental freedom of this country is at stake, that just as a citizen, I want to stand up and to say whatever I can and think through the issue, but make the case for freedom in whatever way is actually like the true application of freedom. Doesn't mean the government doesn't get involved, but it means that fundamentally we need to be free to live our lives and to act and not be controlled by government. So that's the flourishing and the freedom element of things. But the thing I really want to focus on, and why I think I have something to say here, even though the specifics are not my area of expertise, is this issue of framework. And let me just, for those, I mean, many of you watching this will be familiar with my work, probably my book, The Moral Case for Fossil Fuels, and more broadly known as somebody who tries to think about energy and environmental issues in what you can think of as a big picture and pro-human way. And I'm very focused on what, if we look at all the benefits and side effects of different energy sources or different options, what's actually the best for human flourishing going forward. And one thing I've noticed in my research is that it's very often true that the designated experts in our society make radically wrong predictions about fossil fuels, but also more broadly other aspects of industry. And then they make catastrophic, they prescribe catastrophic policies. So there's a very strong historical trend of declaring a false or exaggerated catastrophe and then advocating for truly catastrophic policies in response. And often the narrative is, if we leave people free, they're going to cause a catastrophe, so we need to prevent them from being free and solve the catastrophe, whereas usually the preventing people from being free would actually cause the catastrophe. So one, I think, very glaring example of this is in the late 60s and early 70s, there was a narrative supposedly determined by all the leading experts that we were going, if people were left free, they were going to deplete the earth of resources. And I talk about this a lot in chapter 1 of The Moral Case for Fossil Fuels, which you can get for free online. And there's this idea that, oh, the earth's resources are finite, we're using them quickly, we're going to run out, everyone's going to fall off a cliff and starve, therefore the government has to radically restrict production, including the use of fossil fuels, but really including the use of everything. And what actually happened is we didn't run out of resources. It turned out, as certain thinkers like Ayn Rand and later Julian Simon argued, resources are effectively unlimited because resources are just matter and energy reshaped by the human mind in useful form. And so we have an unlimited ability to create them. And so from the 70s forward, we created more and consumed more and more and more resources. And yet we became wealthier because we were substantially free. And places like China and India went from desperate poverty to much, much higher life expectancies, standards of living. And had we followed the recommendations of the catastrophists, we would have been in huge, I mean, that increase in life expectancy definitely would not have happened. And it's very possible that life would have gotten even worse overall, let alone the lack of progress. So part of the context that I'm bringing to this issue is I have studied a lot the history of supposedly expert catastrophe predictions leading to actually catastrophic prescriptions. Now, it doesn't mean that anytime the supposed experts say that there's some catastrophe or some big problem, that means it's false. It can't mean that, but it means that that is a possibility in what I would call our knowledge system, and whatever the mechanisms are by which we interface, by which people are selected as experts, and by which they deliver us knowledge. This involves research and universities and government and institutions like the New York Times. However that system works, it's clearly very possible for it to claim a false catastrophe or predict a false catastrophe and then actually make catastrophic recommendations or policies. So that's something I'm always on the lookout. I don't know that it'll be the case, but I know that it's very possible. And one thing I I'm aware of is what causes these false predictions and catastrophic policies. And I think fundamentally, you can think of it as bad thinking methods. There's something wrong with even the way very smart and specialized people are processing the data, processing information, where they can come up with a very wrong prediction or a very bad policy. So it's the thinking methods. Even really smart people with bad thinking methods can go way off course. And in fact, they can go more off course than bright people, than dumb people with bad thinking methods. I mean, historically, Stefan knows this above all because he's in Germany, but I mean, you have Germany, the land of poets and philosophers, elects the Nazi party by a plurality with the endorsement of leading intellectuals. So it's really possible for smart people to go way off course. And then there's a question, well, what leads to bad thinking methods? And I'm going to connect this now to the COVID stuff. And I would describe it as your framework. So the framework I think of as the starting structure of your thinking. And in particular, the framework is what assumptions do you have that may not be true? And then what values might you have that may not be pro-human or good in the eyes of the people that you're talking to? And when I've been looking at these COVID claims, the catastrophe claims, and the prescriptions, I've noticed a bunch of assumptions and a bunch of value claims or values, or at least value premises that are very disturbing to me. So I just want to point out some of them, and then I'm curious with Don and Stefan what you guys have noticed. And I just want to emphasize, from everything I've seen, I do think this is a very serious problem. I think it very likely will even have tragic level consequences, and it is something I'm actively concerned about. And I'm on California lockdown, but even before that, and even whatever that is, I've been voluntarily quite a bit changing my behavior because I think it's worth it to do so given the knowledge that we have. But it's really important. There's a difference between something that has tragic consequences and something that's a catastrophe that in any way warrants stopping the productive lives of hundreds of millions of people and even billions of people around the world. So it's really important, if there are dynamics that lead to dramatically exaggerated predictions, that we be aware of them. And so here's what I've noticed in reading a lot of the mainstream things, and including some of the popular long articles. And in particular, there's a guy named Tomás Pueyo. I don't know if that's the proper pronunciation, but it's a very smart and influential guy in the tech industry who's written 2 very influential pieces on Medium. And I think those are fundamentally misguided by some of the things I'm going to be talking about. And a lot of the analysis that's like that, I think, is fundamentally misguided. That's not to say that all of the data is wrong, all the analysis is wrong, that the people have bad intentions, but I think that the assumptions and values are very off. So, and I'll probably say more about this later, but I just want to give you an overview because I think you'll be able to recognize these things. And so the first thing in terms of assumptions is if you look at how predictions are being made, and in particular how models are being made, the behavior of free human beings is being modeled as mindless or stagnant and I'll break this down, but when it comes to both avoiding COVID-19 and when it comes to treating COVID-19. So my shorthand for this is mindless models. And this has a real history in terms of experts making wrong predictions where they'll make models, but one of the things is they don't model the positives of human ingenuity properly. And then they also don't model in particular the positives of human ingenuity in negating negatives. So people will say, oh, pollution is going to go out of control and we won't be able to do anything, or a certain thing will change in climate and everyone will die. And yet what actually happens is human beings are continuously adapting to nature, to their surroundings, and even mastering them through their intelligence. But it's a very common phenomenon to take some trend and to just say, oh, this is a negative trend. Human beings will not adapt to or master the situation. They'll just mindlessly go like lemmings. And I think if you look at the different kinds of models that people are using, there's not anywhere near a sufficient accounting for human ingenuity and human adaptation. So one example of this, so one broad example of this is there's this variable R in the different models which relate to how many people do you pass an infection onto or a virus onto. And the idea is if it's above 1, then you get a certain kind of exponential growth, and you don't want that. And there's an R value, usually like 2.3 or 2.5. But what's interesting is over time, it's assumed that people will continue to pass on the virus at that rate, even if it's causing disastrous consequences. Whereas logically, even what we're seeing so far is people are dramatically, voluntarily changing their behavior once they're aware of the virus. And imagine that it was on the more bad side of plausible things, then they would do that even more. And yet people have all these scenarios which say, oh, well, it's all going to go out of control and it's just going to keep rising exponentially, et cetera, et cetera. But they're not accounting for human adaptation. They're treating human beings as mindless. Another example of this is with the ability of hospitals to adapt. You'll see this idea of flatten the curve. So the curve is like this, and then there's a line that's hospital capacity. And so you don't want the curve to go way above the line. You want to flatten it. But usually the hospital capacity is viewed as fairly flat, or it just rises a little bit. But I think there's a lot of reason to believe that that kind of thing could rise quite a bit, particularly if you just think about smart individuals at every stage of things like diagnosis, early recommendations, treatment, like them thinking about things more intelligently. That can make a big difference, and you don't see that significantly accounted for. A big thing that relates to both the, I think, evasion or ignorance of human ingenuity, but also relates to values, is that the models I've seen do not allow for a very rational thing, which is selective isolation based on risk profile. So you'll see people talk about these. What was I going to say? I lost my train of thought for a second. Oh, you have all these kind of catastrophe scenarios where it's saying, oh, well, this many people are going to get it, and it's going to use this many hospital resources, and it's going to be this disaster. And yet logically, people who are more at risk will have a tendency to self-isolate. And those are also the people who need the most hospital resources. So to the extent those people avoid getting it, they avoid using those resources early on, and it dramatically changes the curve. And yet the way these things are created, it's acting as if we are all a uniform population. And so there's just this question of an R for everybody versus making clear, oh, wait, no, the portion of the population that's most vulnerable, they can selectively isolate. That makes a lot of sense morally, and practically would radically change this. And yet the models don't account for that kind of very intelligent and I believe very moral adaptation. Let me just see if there's any others. I mean, there's a lot, and I'll talk about different forms of ingenuity as we go, but the broad thing that we see is just these models don't really recognize how human beings left free have ingenuity and will exercise a lot of rationality in pursuit of their values. That doesn't mean that they're always going to be totally rational, certainly not as some external person would prescribe, but these dynamics are crucial to recognize. There's one other aspect of it that's related to these, what I would call mindless models, which is often when the models are trying to model lockdowns, they equate locking individuals down with preventing reckless behavior. It's like, oh, well, if we lock them down, then they're not going to engage in this reckless behavior. They're not going to replicate. And as I'll talk about more later, I don't think that assumption is warranted at all. I think when you lock people down without a clear explanation, without a definite timetable, they're going to violate that left and right and do lots of irrational things because they won't really have an idea of what does make sense for their lives. So there's the models and the discussions around them. The core is they're treating the free human being as mindless versus recognizing that the free human being has this power of rationality and then really trying to appeal to that power. So that's one huge thing. And when you think about, if you're talking about a catastrophe, I believe probably means a catastrophe for human beings. So if you're coming up with a projection and you are not taking into account human ingenuity in such a systematic way, you're going to be way off. Now, that doesn't mean that there's no problem. I suspect there are going to be some significant problems, but the whole way of thinking about it and quote unquote experts making these predictions with these fundamentally false assumptions about human nature and human freedom, they're guaranteed to be wrong. I've been talking for a while. Did you guys have any thoughts on assumptions that you've seen that make you skeptical of the different predictions?
Well, I think one, I don't know if you put this under the category of assumption or value, but certainly I think not appreciating the role of production. So here's just one form that it's come out, which is a lot of the discussion has been pitting Main Street versus Wall Street and saying, well, we shouldn't care about what happens to Wall Street. We should only care about people's lives. And I think if you have the concept of human flourishing and you grasp the role of production, and then you grasp the role of finance in production, like you can't pit those two against each other. If we completely wreck the economy, including the financing for the economy, then health and lives suffer. And just more broadly, and maybe you'll get to this later, I think, we've certainly seen some of the more consistent environmentalists explicitly, say things that have a wrong or an anti-human flourishing approach. I think Extinction Rebellion's been sticking up stickers that say, we're the virus, coronavirus is the vaccine. But I think more common is just not having explicitly a framework and valuing human flourishing on principle, and therefore underrating or putting the only consideration is sort of saving lives from the virus, and then everything else is not considered a legitimate value that has to be integrated towards that.
Yeah, I'll definitely talk about that under values. Stefan, did you have anything on the assumptions?
Yeah, so connecting to the framework issue, what I notice is that we are probably engaging, or the public discussion is engaging a lot in team play instead of finding the truth. So you see a lot of experts recommending certain things, and then they work their way back, in the narrative to proclaim what's necessary to have their outcome, their recommended outcome to be true. And so what I see is that we have to be super honest about the information that we do have and their reliability. And we have to be super honest to ourselves and in communicating this. And what I don't see is people saying, well, there are certain aspects that we don't know. So there are people that are spreading theories, and then the media is probably not correctly quoting them, or changing the information on the way. And so this is very detrimental. So as you mentioned, there are certain variables in the models. And so we will probably, or the government will probably at some point settle on some kind of model to predict things, and then, make some measure happen based on that. But it's in a situation of uncertainty, we certainly need to take that into account and rely on individuals to make their own decisions. So for example, a very vulnerable population where we have information needs to, isolate itself more than young people who don't seem to be as affected. And so I think the spread of information and contradicting information is a big problem. So we need to improve that framework in the sense of being super honest and finding ways to find out who is super honest, who is acknowledging uncertainties, and looking at Europe, which now has the largest number of deaths globally, even higher than China. You can certainly make mistakes if you don't acknowledge certain uncertainties and communicate what information you really have.
Yeah, I think the honesty point is really important, and it's actually related to something I've been thinking about with myself, is just being aware of confirmation bias. Because I'm what I've noticed with this issue is I had a sense very early on that the thinking was off, and that some of these catastrophe scenarios were off, but it took me a little while to wrap my mind around, okay, what is off and what isn't, and what do I know and what do I not? And so I would see articles that were more inclined toward what I intuitively thought, and I would share them. I'd usually ask, hey, what do people think about them? And this seems intuitively right. But I think I had a little bit too much of an inclination to not be as critical of some of them. And I think it's really important, and in part because I felt like nobody was methodologically doing what I would advocate. And so, I mean, one thing I've decided is, okay, I'm gonna try to spell out what I think is necessary methodologically, and then work with other people on that versus sharing existing stuff. Because part of sharing other people's applications is I don't know exactly how they're processing the data. Right, I'm going to get into one other assumption issue and then a value issue a little bit more quickly, but just to give you an overview, and then I want to jump into where I think the big picture, the plan should be going forward. Because I really think that as a nation, we really need a plan, and I think that the human flourishing approach that we take can really inform that plan that we take at Center for Industrial Progress and at my podcast, on my other podcast as well, the Human Flourishing Project. So one thing I notice about the models, and this one I don't have the same level of certainty about, but I'm noticing it, there's definitely something there. So if you can think of the first one as the models have a mindlessness to them, and then I would also say the models have at least their tendencies to have exaggerated maliciousness. So I'd say there's mindlessness, and then there's exaggerated maliciousness. Now, what do I mean by that? I mean that the extremeness of the virus's danger seems to be significantly exaggerated, where like, and this is in a couple categories. One is that certain mitigating aspects that are generally applied to viruses tend to be downplayed or considered trivial. And then where the data are ambiguous, there are liberties taken with them that make them seem a lot worse than I think the plausible interpretations are. So in terms of just things that are ignored, for example, there's this broad issue of, well, the viruses, or at least many viruses, tend to get less severe over time. And the reason is because viruses, if they are less severe, it's easy to pass from one person to another, whereas if the virus kills you instantly, you're not going to be able to pass it on to many people. And yet I don't see the models taking that seriously. And often people don't even talk about that, but then they'll talk about seemingly much more unlikely negative mutations. Another thing is the models, or at least a lot of the models I'm seeing, don't significantly take into account seasonal decline. With certain viruses and even certain coronaviruses has been a significant thing. So I don't know the magnitude of how significant these are, and I don't know if anyone does, but it's notable that they're left out. Now, in terms of negatively interpreting what data we do have, and there's a whole issue of we need more testing, we need more data, which is going to be the foundation of the plan that I think we should be following as a nation. But you can see with certain, the data that we do have, there is just a lot of tendencies to distort it. So the biggest thing I think is the death rate. So you hear these things of the death rate, and the death rate is 4%. And so the death rate is a function of, well, how many deaths are caused by COVID-19? And so that's the numerator of the death rate. And then how many people have been infected by COVID-19? And that's the denominator. And if you think about the denominator first, the number of people who had it, that is being systematically underestimated because people are equating the case number, the actual number of the number of diagnosed cases, they're equating that with the actual number of infections, whereas there are definitely more infections than diagnosed cases, and there may be way, way more infections than diagnosed cases. And yet people keep repeating death rates that are literally equating number of cases with number of infections. So that's, of course, going to increase the death rate, and you really need to acknowledge that if you're using these death rates. There's also the issue of what I think it's called comorbidity. So everyone who's dying of COVID-19, who dies with COVID-19, that doesn't mean they died of COVID-19. And so if they had it and they died, that doesn't mean that they're dying of that, or that they weren't about to die from something else. And so what you really want to see over time, we can't have this now probably as well, but you want to see the overall mortality. How's that affected by COVID-19? Because otherwise you can have someone with 3 diseases and then you say, oh, well, he died of lung cancer, he died of COVID-19, he died of a regular cold, he died of the flu. So both of these factors, and I'm sure many others, are tending to exaggerate the death rate. And it seems like a lot of the public discussions don't care about being too careful about that. So there's this systematic tendency to exaggerate the maliciousness. Now, there may be things that are underestimated that are significant. So I can't say what it actually is, but I know for sure that the mindlessness assumption is leading us to ignore the positive aspects of human ingenuity in a massive way, and that there is this tendency to exaggerate the maliciousness. That certainly occurs in all the environmental false predictions I've seen, where negative changes to our environment, sometimes they don't even end up being negative, but when they are negative, it's viewed as, oh my gosh, this is the end of the world, versus, oh no, this is significant, but it's something that we can manage, or at least manage a lot better than people thought. So those are how assumptions can totally distort the views of experts, and in particular, the view of experts that are the designated experts, because we're not being exposed to everyone who's a specialist in the field. We're being exposed to certain people who have been elevated to positions of thought leadership. And I think there are certain systematic things that lead to the people with more exaggerated negative views to, and less of an appreciation of human ingenuity, or very little appreciation of human ingenuity, to be at the kind of top of that food chain, and for the more extreme negative views to be promoted by a lot of our trusted knowledge sources. Okay, the values point I'll make more quickly, because I talked about that a bit last week, but the overall, and Don mentioned it too, but I'd say overall the issue is the value of the livelihoods and values of the young and less vulnerable are treated as trivial. So the value of, you can think of the young and less vulnerable, particularly their livelihood, their work, and then their values, their chosen lives, they're treated as trivial. And so I just want to give you some examples of this. So one is that if you look at the claims of deaths, it's like coronavirus caused this death. So the deaths of all kinds are treated as equal. And whether they cut a life expectancy short by 50 years or 50 days, it's just all treated as, oh, this is death. Whereas I don't think that's rational at all to equate those. Also, the focus on exclusively deaths does not factor in at all the quality of life. But if you think about it, the quality of life is the main reason we want to be not dead in the first place. And I'm seeing this where I live in Laguna Beach, older people walking around, and in my complex, even some were using the swimming pool. Now, I don't think that's maybe well advised, but some people are on the premise, hey, I don't have much longer to live. I can't put my life on hold for 18 months. I want to live. Again, that might be rational or not, or you might think it is in any given circumstance, but notice their priority is on quality of life. Their priority is on what I would call flourishing. And so I think of this overall thing as the whole focus is on non-death, but it's not on living. And my view is if you're focused on human flourishing, you're focused on living. That's what you want to make possible. You want to make it possible for people to truly live in a way that they will find satisfying. And this is what's so wrong about what you heard Andrew Cuomo say. It was something like, I'll do anything to save a life, but that means I will prevent any number of people living to prevent the deaths of other people. But we all want to be living. So we need to think of policies that allow us to all live as much as is possible. And then there are questions of how do you make those policies, and I'll give some guidance on that. But there needs to be a focus on living, and not just avoiding death a few days earlier, or even a few years earlier. And if you have a nation that doesn't focus on living and value living and flourishing, it's not going to value freedom. But one of the core reasons we value freedom is because it allows us to truly live. All right, let's see any of these others that's important. There's the broader points. Another one is that in terms of the devaluing of the lives of most people, when you hear the death rates, they're primarily recorded across all age groups and or all health levels. So it'll be 4% death rate. And I think there are big reasons to think that's hugely exaggerated. But then they're not distinguishing among different groups. And so they're obscuring the fact that they are asking for significant sacrifices from the young and healthy to the older and unhealthy. And you could say there are reasons that you want to help them. There's certainly reasons I do, but there's just this, I do not think it's at all okay to just devalue the young and healthy and or to misrepresent the situation that those of us, and I would put myself relatively in that category, that we face. And then a point that Don made and that we've made before is that the whole discussion of the models does, in terms of values, it's not taking into account the value of productivity to living in the full sense, and even to avoiding death. And the idea that you can stop or dramatically diminish the livelihood of tens of millions of people and just call that the economy, or even call that Wall Street, and say, oh, that's not lives. I view that as a fundamentally anti-living view of life. So you can say it's not exactly anti-human because it's some humans over others, but it's really an anti-living, or what Ayn Rand would call like a living death perspective, where you're just sort of worshiping the absence of death versus the living of life. And so I think that all of this is leading to, like, we have a situation where all the focus is on how do we avoid the worst case scenario the worst case scenario as modeled with these false assumptions on a specific portion of the population. And it's just, well, if we can come up with a very scary model that says that certain older people are going to have their lives cut short by a year or 2 or 3 or even a month, then everyone else's ability to live should be sacrificed, including the ability to live of the elderly, because I don't think of people in collectives. There are a lot of elderly people who really do want to live and who would think it's worth taking the risk. And I think we should think of ways as a society to let that happen without letting them necessarily harm others. And that's a whole interesting policy issue. But so the broadest things are, we have this assumption of mindlessness. I think that's the fundamental assumption. And also this assumption of exaggerated maliciousness of the disease. And then values wise, we're not valuing living. And that's leading to this total distortion where the government's saying, yeah, I'm going to prevent everyone from living in the name of life. And that is what I think is happening. Okay, so that was the first segment, which lasted way longer than I thought. I obviously had a lot to say about this. You might even have to do this in 2 parts. So I'll check on your guys' availability later this afternoon. But at least on this first hour of Power Hour, let's focus on what should be the path forward, because this is something I've been really thinking about. And because what I see happening right now is, as I put it, the policy, the view, the way of dealing with a dangerous or deadly virus, the method is basically to stop everyone from living. That is the current method. I think that's very just immoral, and I think that cannot be the right solution. So I've been thinking a lot about what is a path forward that allows us to live, but also allows us to effectively fight this virus and save as many people as possible. And so I want to share with you that this is my current thinking on what the platform should be. And I'm particularly interested in ideas or additions that people in the audience have. And in particular, if you study this issue professionally, definitely that. But even if you've been studying it in depth and you think there are a lot of good examples, or you think there are counterpoints that I'm wrong about, I definitely share those to alex@alexepstein.com, because I want to write something about this. But it's the kind of thing it needs to be. I'm thinking of it as a skunk works. I'm putting together certain people to do this, because I think I can help a lot with the framing of it, with the thinking of it, with the explanation of it. But I need to work with people who have expertise on a lot of the details of it to make sure that I'm getting, at least have the best possible chance of getting those things right. So I'll take a drink of water in a second and then give it to you, and try to give it to you in 15 minutes. But my overall title is Don't Stop Living, Live Smarter. And it's an American path forward on COVID-19. So I want to talk about, what does an American path forward on COVID-19 look like? So I'm going to summarize this. It's going to be 6 steps. I may change the number of steps, and then I will elaborate a little bit on each step. And then if we have time, hopefully you guys can chime in. But here are the 6 steps. So 1 is acknowledge the difficult reality we are in. 2 is recognize that an indefinite universal lockdown is both impractical and immoral. 3, massively increase testing and transparency. 4, liberate American ingenuity to massively increase treatment ability. 5, help the vulnerable minority protect themselves. And 6, go back to work with distancing best practices. So 1 is acknowledge the difficult reality we're in. 2 is recognize that an indefinite universal lockdown is both impractical and immoral. 3 is massively increase testing and transparency. And that's the one I'm going to focus on, actually, along with 4, liberate American ingenuity to massively increase treatment ability. And then 5 is help the vulnerable minority protect themselves. And then 6 is go back to work. And for that matter, go back to school with distancing best practices. So I think that this is essentially the right policy in a wide range of scenarios about the specifics of the virus. So try to go through this quickly to just give you an overview, and then very eager for any feedback or ideas you have about any of these points. So you can send those to alex@alexepstein.com. So the first two I'll try to go through really quickly because I've dealt with some of them already. But number one is acknowledge the difficult reality we're in. So I do think that the growing spread of COVID-19 in the US and around the world is quite possibly the most dangerous infectious disease challenge we've faced since the Spanish flu over 100 years ago. So I'm not certain of that. And there are reasons why it could turn out. There are reasons why I don't think we should be nearly as catastrophist as some of these models are saying, but there are a lot of reasons to be seriously concerned. And I'm certainly not going to act like I'm certain that we shouldn't be concerned. So I'm inclined to be quite concerned. And so there's strong reason to think that the worst case scenarios are highly exaggerated. It may be inevitable that there's tragedy. I think we certainly have to accept, unless you are an expert with a really strong different view, I think you have to accept that as a possibility. And we can talk about what could have happened differently in the past, but we're at a situation where we have the spread of this virus, and we're really not, we really have not been prepared for it in terms of a testing level and a treatment level. And those are facts. And then this brings us to step two, which is recognize that an indefinite universal lockdown is both impractical and immoral. So anyone who thinks that, oh, well, here's an easy solution, let's just have an indefinite universal lockdown and then we'll just kill the disease and everything will be good. Like, that is no solution at all, even though it's been the solution, the attempted solution in effect, which we're seeing just completely fail in terms of human life overall. And so one thing in terms of the practicality is, in the United States, an indefinite universal lockdown is not going to work. And I'm glad it's not going to work unless you totally change the character of the country, impose martial law. I don't know where you're going to get those resources from when everyone is poor and not able to produce. But the idea that, oh, we can just lock everyone down indefinitely, like that'll work for 2 weeks, maybe 3 weeks, not going to work for 3 months. It's definitely not going to work for 18 months. And many people say 18 months is the period that we need to be really in action. So even if you could supposedly do this in China, and that's a good idea, like, you can't do it in the US. And more to the point, you should not do it in the US for the reasons that I've mentioned. To stop people from interacting, that's a fundamental violation of their freedom. To just do that in a universal way that prevents them from pursuing their livelihood, that is so destructive. And it's destructive in every aspect of life, including survival itself. I mean, you'll see suicides go up, you'll see poverty go up, you'll see shortages of all sorts of things. And anyone who has good data on this, by the way, I'm interested in that. There's a lot more to say about this, but I've already talked about it. So I want to focus on the more proactive parts of the plan. So once we recognize, okay, we're in a very difficult a very difficult reality, even if we wish we weren't or we shouldn't have been. We got to recognize that an indefinite universal lockdown is both impractical and immoral. And step three is then massively increase testing and transparency. So this is really the key, and it's been talked about, but it hasn't been talked about nearly enough, and not in quite the right way. I'm going to run a quick test with you guys. Can you still hear me? Can you guys still hear me?
Yeah.
Okay, perfect. That my AirPod is having some sort of static, and it was just like, it acted like it was about to electrocute me. So I wanted to avoid electrocution while talking about living and avoiding death, for that matter. So if we think about what's wrong with the case for universal lockdowns, part of it is it's based on the premise that Americans, if left free, will be mindless and inconsiderate. And as I've said before, this is really untrue. It's been demonstrated to be untrue. A lot of us, including I'm sure all of us on this call, have engaged in a lot of voluntary behavior to protect ourselves, but also to protect others, and to try to limit the spread of the virus as long as we could do it in a kind of cost-effective way. But what's also true is that we could exercise incomparably better judgment if we had more information. And so the foundation of a free people's response to this virus has to be information. How deadly the virus is, how prevalent it is, what available, and also, this is a really important one, what are the available treatment capabilities in my area. Because if you knew that, if you could just really have a hot map of who has it, where it is, and what the treatment capabilities are, then you would be in, like, you could act so rationally. And so that's what we should be aspiring to. And I think if we look at the government's failures, I don't want to talk about all the specific things involved, but I think there's been a combination of restrictiveness with regard to testing in terms of preventing private actors from testing. And there's definitely been a lot of opaqueness. Like, we really don't know what the state of testing is. There hasn't been the transparency. And so I think that government's number one priority should be systematic testing and sharing of precise information with all Americans. And it needs to do certain things in terms of its own practices, but one thing it definitely needs to do is it must liberate American ingenuity to work on both developing new types of tests and also the mass production of tests. So that's been happening a little bit, but I've still been seeing there's a lot of restriction going on with the development of tests. And I think it has to be, no, our number one goal is to give all kinds of information. And I'm interested in what people think about are the most important kinds of tests. I think it's really important to do tests so that we know the actual rate of infection in randomly sampled populations. It will be really valuable if we can understand not just who has it now, but who has had it in the past. That'll what these kind of these different kinds of tests, including monitoring your antibodies or testing for antibodies in ways. So this is really the systematic and transparent testing. This is the key. So for example, in terms of the government, if there are situations where the government needs to make targeted responses, and I think if it's using coercion, it needs to be very careful and very clear about the duration. But if it wants to do some kind of tracing, like seemed to work well in South Korea, needs information, needs systematic testing, and definitely needs transparency. But then if you think about what this will do for us as individuals and organizations, it'll allow us to make very intelligent distancing decisions based on, based on where we are and based on how at risk we are in particular. So far we have that if we have systematic and transparent testing, it'll enable governments to make targeted responses, and then it'll enable individuals and organizations to make very intelligent distancing decisions. If we really know the specifics of, okay, where is the virus? How dangerous is it? How dangerous is it for our specific population? The more precise it is, and that's part of being systematic, just the more intelligent decisions we can make, as well as knowing these things about hospital capacity. And then in terms of, if you have systematic and transparent testing, imagine what it does for medical professionals making intelligent treatment decisions. It's just, if you think about things like allocating resources, where people are most needed, where masks need to go, like the more details we have about things, the more intelligence people can exercise. A truly American response is free people exercising their ingenuity to just figure out all kinds of ways to stop this, to avoid this, that some centralized authority is never going to be able to figure out. But we need information. Right now, we're totally handicapped, and that's something the government can and must take a leadership role in. And part of that is being very, very transparent. So that's step 3. So that is massively increase testing and transparency. And then step 4 is liberate American ingenuity to massively increase treatment ability. So the greatest asset we have in the fight against COVID-19 is not our ability to enslave people. It's human ingenuity, whether in diagnosing, treating, developing drugs to mitigate COVID-19, developing vaccines, shifting resources around, repurposing factories, speedily scaling production. All of these things require human ingenuity. And what that requires above all is freedom. And so the main role government has to play here is to lift the dozens of irrational controls that are inhibiting the medical industry from scaling treatment. And so we don't have that much time, but Don, I know you've been sharing with me a couple of examples. What are things that strike you about what government is doing to control production in this realm that it needs to stop doing so that we can liberate human ingenuity?
Yeah, I mean, one thing I'll say first of all is that things are changing so fast that some things might not be enforced. And in fact, I've been impressed with a number of the regulations that have been rolled back and changed. I've not been impressed by the fact that they were in place. But for example, with testing, initially the government very tightly controlled who could do testing, and that was led to these long delays and lack of tests. And that's largely been opened up. Although, as I understand it, the FDA is still preventing home testing, which a number of startups have been trying to engage in. So I think that is certainly one area where if it's not fixed, it needs to be fixed. Another area that has had government control interfere with it is there's I think a pretty compelling argument, at least insofar as I've been able to judge it, that rapidly expanding the availability of masks, including to the general public, as one element of social distancing, it would be a very powerful tool, let alone the ability to protect, frontline workers or anybody who's highly exposed to the virus. But it's more, it is successful as inhibiting the spread from somebody who's already infected versus just protecting you from if you haven't been infected. But nevertheless, there's been a lot of government restrictions on the production of masks, and therefore there have been shortfalls in masks. And so, for instance, I recently read a tweet from somebody who said that I've been working on a N95 mask production project. N95 mask is just a kind of medical mask, with a team for about a week now. We just got off the phone with the National Institute for Occupational Safety and Health. They told us that the approval for a new mass production facility in the US will take at a minimum 45 days, but more likely 90. And he ended by saying a lot of people are going to die. Now, there was new legislation, I think, that came after this that seems to basically say that there will not be lawsuits against anybody who's going to move ahead with making these masks. I don't know the details, but certainly that's an area where if those haven't been removed, they need to be. One general thing, I had an idea very early on that one of the most valuable things the government could do would just be have a website or a hotline where people could report what burdensome regulations were preventing them from responding. And it turns out that now the Booth School of Business at the University of Chicago is doing exactly that. So if you are involved in trying to deal with this virus in one way or another, and you're finding that there are government interventions, I think that is a good place to start about just letting the world know. Sure, if you just Google Booth School, University of Chicago, COVID regulatory pauses, that will come up. But I think that's a very high leverage area where we can expand freedom and therefore reduce the threats.
Yeah, and there are lots of other examples, and I'm certainly eager for any listeners to share any examples you have, because I'll definitely put them in the plan. In terms of what else the government can do, so I think that particularly the government has a big role in the scale of this problem in terms of negative things for a whole bunch of reasons. I think that it's legitimate and an emergency for the government to supplement the situation, as in encourage the production, but the context has to be it's allowing human ingenuity to come up with all sorts of solutions, and then it's providing some of the backing to do that more. And it may be helping businesses, paying them to repurpose production facilities for vital medical supplies. Certainly the whole way workers are being treated, I think that's a whole other subject, which is a really kind of just really unethical in many cases. So we really need to stop that, and we really need to help them out. So anything with supplies there, I think, is crucial. But it only works for the government to invest in it if people are free to create value. And that's the main thing that's being inhibited. And that's where the totally ingenious solutions are going to come from, where somebody comes up with a treatment and it just not even the experts expected it, but it can just dramatically reduce the symptoms of this thing. Like, we don't know how that's possible, if it's possible in what time frame, but the only way we're going to know is if people are free to think and to act. And then as consumers, as individuals, as citizens, we're free to judge. And then we should learn a lot of lessons from this about the future, that, oh my gosh, what if we were free all the time? Then yes, we would make mistakes, just like we make mistakes when compelled by government, just like government makes mistakes, but we would come up with all these amazing innovations that wouldn't otherwise exist. One more note about step 4, liberate American ingenuity to massively increase treatment ability. Final aspect of this that I alluded to earlier in the context of information is we want radically increased transparency about hospital capacity. Right now, we just see all these graphs that say, oh, well, in general, the hospital capacity will be overloaded if this many people get the virus on this with this progression. But what you really want to know is, okay, what's the trajectory in your area? Is your hospital overloaded? What's the status of that? Because that can really help guide your behavior. It can also maybe, you might even be willing to relocate for a while to some other area. I mean, we really want to avoid these situations where hospitals are overloaded. And so one aspect of that, not the only aspect, but is just transparency. So different people, both consumers of healthcare and also producers of healthcare, can make intelligent decisions. All right, step 5, help the vulnerable minority protect themselves. So the broader theme of this is don't stop living, live smarter. So key to that is to be smart. We need the information. That's why testing is the first thing government should be focused on. And then we need treatment, which is why liberating production of treatment is kind of the second thing. But then in terms of just as individual citizens, the focus needs to be on being really smart. And part of being smart is for people to take responsibility for protecting themselves based on their own risk profile, but also when they're trying to help others, focus on helping the most vulnerable protect themselves. This has been it's been mentioned, but it hasn't been mentioned enough, and particularly not in the different kinds of model projections. Like COVID-19 is not an equal opportunity danger. It's overwhelmingly a danger to the vulnerable, especially the elderly. Now, you hear reports that, oh, it's a danger to everybody, and that's true to some extent. I have reason to think that when they're talking about younger people, it's mostly very compromised younger people. But I mean, certainly it's overwhelmingly greater for the more vulnerable parts of the population. And so anything that involves isolate everyone equally is immoral, and it is insane. If you're focused on flattening the curve, the best thing you can possibly do is help older people protect themselves, because as I've mentioned, they are not only the most likely to die, but they're going to be the ones to use by far the most medical resources and overload the hospital. So if you want to buy time, it's helping the vulnerable protect themselves. And if the government is going to do anything, that's what it should be focused on, doing things like helping deliver supplies. When I go to the grocery store, there's still older people there all over the place. Now, if this is their dream in life and that's their bucket list to go to Gelson's and Laguna Beach, then you know what? I'm not going to stop them. But if there's anything we can do to really help them protect themselves, what's often called cocoon themselves, that's incredibly beneficial. And it's really a travesty that the overwhelming focus hasn't been on that. And instead it's been on these mindless, these just totally uniform and indefinite, by the way, universal lockdowns on everybody that are not clearly explained and that nobody is even following now, or many people aren't following now. And they're certainly not empowering the elderly. Now, I think that there's no case, I do not think you should be able to lock down the elderly or the vulnerable by force for some indefinite amount of time. If there's some very specific emergency that you can prove by doing this for a week or two, or if it's like a real quarantine situation, okay. But like in general, people's lives belong to them. People want to live. And I do not think it's right to take an 80-year-old who's, their dream might be, I want to see my grandchild. I don't know how long I'm going to be around. I think it's just completely wrong to say, oh no, but you got to be inside for 18 months. Now, if they need to move to the bottom of the queue in healthcare and they're willing to do that, we should find a way to let them do that. But I really object in this whole discussion to the just total devaluing of living and people being able to live their lives as they choose. And that applies to younger people and that applies to older people. Then step 6 is go back to work and to school with distancing best practices. So lower risk Americans do not need to stop their lives to dramatically slow the spread of COVID-19. We've already seen that with even kind of crudely given guidelines without that much explanation, people have been willing to voluntarily do a lot. And there's you think about just the things like washing your hands more, avoiding touching your face, keeping more distance. All of these things are huge with regard to transmission. We don't have exact numbers, but just physically, if we understand how the virus works, how it travels, how the more the volume of exposure matters, all these things mean that we can do low cost, effective social distancing measures and get a huge amount of value in terms of slowing down the transmission of the virus without disrupting our lives. And so this is the thing, is to live smarter. And part of the guidance we need from experts is what are the highest leverage things we can do? What are smart ways to do things? And try to figure out smart ways to do everything. Might be even, a mass event. Maybe you keep people a little farther apart. You don't fill the stadiums as much, but we should be trying to figure out ways to do everything, like restaurants, spacing the tables out more. It's totally different to have, make the restaurant modify how they operate versus saying, no, you indefinitely, you cannot operate under any conditions. So I'm very interested from anyone, if you have good lists of, hey, what are good best practices? There's a good an interview I thought was good, at least methodologically, with Richard Epstein, not Epstein, interestingly, on the Cato podcast. It was just the one of him. He's in a debate on another one that I haven't listened to, but I thought he did a really good job. I don't know if his analysis of COVID is right, but in terms of identifying the methodological flaws of a lot of the catastrophe predictions, and then also he gave a lot of interesting, good prescriptions. So these kinds of best practices, distancing best practices, hygiene best practices, we can do so much with these and yet not disrupt our lives. So this can be a totally potent combination. If we start out with, okay, we're going to just get amazing at testing, that's number one. And then we're going to liberate our ability to treat and then just bring all the human ingenuity there. And that's number two. And then three, we're going to really help the elderly and otherwise vulnerable protect themselves. That's going to be our focus because that's the most efficient way to flatten the curve and to save lives. And then at the same time, we are going to, we're going to go back to work, we're going to get busy living, but we're going to be smarter. That is an American solution. I think if we do this, we can avoid just the complete literal depression that we're headed toward. And we can even be a safer and healthier and more benevolent country going forward. I mean, there's this idea of we're in this together. And I think we can be in this together if we're in this together in a way that allows us to truly live our lives in as much harmony with one another as possible. If certain people get to stop the lives of the vast majority of people, that's going to lead to huge resentment. And even if people feel like they're in this together now, they're not feeling like it when their restaurant is closed, their employer is closed, and then they're just getting, a couple checks from the government. And then how's the government going to pay those checks? Is it going to be inflation? There's no happy we're in this together if we cannot live our lives and be productive. So don't stop living, live smarter. I want to go into some of the other topics, but I want to ask if you guys have any quick thoughts, and then also just tell people, I really think this is the right general platform, the right general plan for moving forward. And I'm really interested in people who think they have something to contribute, either general expertise, or maybe you've just studied this a lot and you have good examples. Please share information with me, because this is not the kind of thing like a book on energy where I and my team have all the abilities needed. But I do think that this human flourishing, pro-living based framework, and also this emphasis on knowledge through testing and transparency, and also on intelligence through freedom to produce, as well as the freedom to judge and deal with threats. That's a perspective we bring that very few people are bringing, but I believe that is the American and the moral perspective. So any comments from you guys?
So one of the things that I was thinking about, and you touched briefly on it, I think in point 4, lessons learned, thinking strategically, which is one of the features of the human mind. A lot of the things that we did wrong apparently have a lot of lead time. So, producing enough emergency supplies and, rapidly changing the number of hospital beds and this kind of thing. And usually in our systems, these things are optimized to minimize the cost, which makes some sense if you don't have an emergency. But if you can't quickly change this, this is a problem in a crisis like this. So we should really be thinking about, and maybe this warrants a 7th point in your list, about what the system should be to take this into account, this experience that we are now having and that we can learn from. And something like, what are the problems with a funding model that we can quickly shift resources? what are the problems on the labor market regulations, so that we cannot make available quickly the labor force that we need to, take care of the vulnerable elderly or something like that.
Yeah, I think that's true. I may fold the first 2 points together. I don't like having more than 6 points in an outline, or in a plan. But yeah, I think there should be one. There should be something like that. All right, let's actually just jump in to the next issue, and I want Don to take the lead. Don, I know there are kind of 3 big stories that you have, and you're going to have to do them all in about 10 or 12 minutes. So hopefully you can summarize them. But so we're now moving toward not the issue of, okay, what do we do specifically about COVID-19 in relation to American life, American freedom, but what are some of the energy, we're dealing with some of the energy policy issues connected to it. In particular, there's been a movement to say, okay, well, now this is the perfect time to impose things such as the Green New Deal or other so-called green energy measures. I know, Don, you had a couple stories about that.
Yeah, so here's 2 of them. So we're recording this on Wednesday, the 25th, and it seems that a so-called stimulus bill in the U.S. has gotten the go-ahead. And in the lead up to this, there was a real attempt to use it to extend subsidies for wind and solar. So there's 2 main federal subsidies for wind and solar. It's called the production tax credit, which is mostly onshore wind, and the investment tax credit, which is for solar and offshore wind. And just as a general matter, these subsidies are extremely destructive, and not only because they prop up and incentivize us to use unreliable, expensive forms of energy, they actually cannibalize reliable forms of energy. So, I mean, the most obvious way is simply whenever the producers of wind and solar are getting paid, then the competitors aren't getting paid. But with the production tax credit, which basically says every time wind is blowing and you're producing energy for it, you get a certain guaranteed amount of tax credit from the government, which is essentially money off your tax bill. That makes it so that they can charge below market prices for their energy and even pay people to take their energy and still profit. And so what you're really doing is you have all of these people who've made investments, say in a nuclear plant or a coal plant or a gas plant, and they are not able to compete with these subsidized forms of energy when those forms of energy are available. And so this makes it really hard to recoup the costs and can actually make a coal plant or something unprofitable where it should be profitable. And to make matters worse, that because we're giving preference to this unreliable forms of energy, you're turning down and turning back on, or you're trying to ramp up and down forms of power, coal and nuclear, that take a long time to do that. And it's very efficient. And it means that they can't be back online in time to sell energy when wind and solar flag to recoup their costs. So, we've talked about these dynamics somewhat in the past, but at a time when we really need, when the government's saying that we desperately need to take action to save lives, we've seen this attempt to inject this into the so-called stimulus bill. And although it seems that they failed in this case, there's an attempt to push it into future COVID-19 aid packages. And I think, just this is part of a larger trend where the Green Movement and its allies have really failed to persuade people to adopt their agenda in many ways. And so they seek to get it by whatever means necessary. We've talked about the ESG movement and the way in which in the Keep It in the Ground movement has tried to use finance in order to punish and penalize fossil fuel companies. I think this is the same sort of thing where it's not genuinely trying to persuade people to adopt their policies, it's trying to impose them. A more radical attempt along the same lines, though, has been the concoction of a so-called green stimulus. And I won't take you through all the details, because what the core thing you need to know is that it's essentially the Green New Deal. It calls for at least $2 trillion of government spending on so-called green jobs and accelerating a so-called just transition to fossil fuels. And it says, now you'd think if this is a stimulus in the case of an emergency, this would be a one-time $2 trillion, but they call for automatically renewing the so-called stimulus at 4% of GDP, or close to $1 trillion, until the economy is fully decarbonized and the unemployment rate is 3.5%. So
that's definitely never.
Right.
I mean,
so that's
both,
for infinity.
Yeah, do they have an upper bound at which, like, once they get it to 10% or 15%, then they get to stop?
No, I mean the upper bound is fully decarbonized.
Fully unemployed.
Right. And I mean what can you even say about this except for this is not something I'm skeptical of stimulus as a concept. I think that if you're talking about the government just spending money, it's very dubious that has any positive economic impacts. But this is, I think, an outright obvious case of not just wasteful spending, but outright destruction, because you're destroying the energy that we need in order to have a productive economy. And you're doing it at the time in which we most need the energy that gives us a productive economy.
I mean, it's a simple kind of way of thinking about it as, we have a crisis of declining productivity. And then the solution to that is, let's make energy way more expensive and make ourselves even less productive. I mean, that's essentially what this amounts to. Right.
And, I mentioned those stickers by this green group, Extinction Rebellion. And I mean, people have pointed out, and I think this is right, that what we're actually experiencing in many ways is the green ideal in a certain form, which is that we're not transforming the planet. We're not impacting the planet. People have showed maps about how this is reducing, pollution and traffic and things. Like, this is the kind of ideal of minimizing our impact. It's not producing, not going to work. And unfortunately, I think we're experiencing how painful that can be for a few days, let alone, and it's a few days in a context where we still have lots of fossil fuels providing us with power, which leads me to the last story that I wanted to raise. And that is the way in which we're really experiencing the value of fossil fuels. And, our knowledge system really has us focus on how green and renewable our energy sources are. That becomes the kind of standard for evaluating them. And at least occasionally, though, they will give lip service to the value of affordability, such as when they pretend that wind and solar are affordable. But one thing that I think gets totally ignored or minimized is the value of reliability. And we know that reliability isn't guaranteed. We've had moments, and we've talked about them in the show, whether it's the bomb cyclone, the polar vortex, where we have not had or almost not had reliable power when we needed it the most. And in those cases, what's stepped up has always been fossil fuels, and in particular coal, because they are among the most reliable energy sources that we have, particularly compared to wind and solar, which are completely unreliable. And we've talked about the way in which during cold spells, wind in particular, wind turbines automatically shut down at certain cold temperatures. But I think it's really important to appreciate right now just how bad this would be if we did not have reliable energy. And the fact that we have fossil fuels, I think, has made a painful situation, prevented a painful situation from becoming catastrophic. But even among fossil fuels, I think it's worth noting that, natural gas is amazing and generally reliable. But I think it's coal that really stands out, because whenever you have this very quickly developing situation where it's not clear how much we can travel and production can become very challenging. Here's a source of energy that can be stored on site for long periods of time. And so being thankful that we have fossil fuels and coal, which has been, I think, extraordinarily demonized among a demonized set of fuels, is really important. Whereas this is a moment in which they are continuing to be demonized. For example, we've seen that in coal's been criticized for seeking COVID-19 relief, not asking for special favors, but just there were special taxes that didn't make sense that were imposed on them that they asked that certain coal organizations asked be reduced back to their 2019 levels. We've seen that mining was in several states deemed non-essential precisely in order because there was
coal mining in particular.
Yeah, there's an animus against coal, and thankfully, I think that has been rescinded at least in many states. But I've certainly had the thought, and I don't think only because where we work in this time of like, man, this is bad, but it's nothing like what it would be if we didn't have reliable energy.
Yeah, I mean it's really scary that a coal mine is regarded as non-essential. I mean, if you're thinking about, okay, what are the very basics of life? Like, we need to sustain ourselves with food and water, and we need to protect ourselves from the elements. Energy, reliable, continuous flow of energy is essential to all of that. So anything you're doing, like anything that involves the electric grid, that needs to just work like clockwork. And anything that involves transportation, that's in particular an oil issue, that needs to continue. So when people are thinking, I mean, if you think of food as essential and warmth as essential, and cooling as essential when it's in the context of it being hot, like if those are essential, energy is essential. And more broadly, if production is essential, if you need to create value to live, then energy is essential. So anything in terms of the whole energy industry, there shouldn't be these essential, non-essential classifications determined by the government anyway. But if they are being determined, you need to regard energy that is essential as the food in the body. Like, this is the food of the entire economy and the food of our livelihoods. I hope that the different people in the industry are successful in making that case, but as citizens, we should really make that case. So if you see that kind of thing going on in your state, or maybe even proactively say, no, like, do not stop our energy industry at any phase of it, from the mining to the conversion to electricity. Okay, so we've covered now about 5 topics. We've talked about bad thinking methods in COVID-19. We've talked about a plan going forward in terms of don't stop living, live smarter. And then Don has had the 3 specific stories. And I just want to cover one more thing, and I guess we're almost at power hour and a half. So this is going to be the longest power hour in a while. So thanks everyone for sticking with me. And I hope that in general, listeners or now viewers are enjoying it. But so just one more story. And for this one, I'm going to have to experiment, for those of you who are watching anyway, with Zoom screen share. So let's see how this works. So before I get to this, let me tell you what this is. So I want to tell you about 4 projects we have for 2020, and then how I'm hoping that some of you can help out. And so this is going to involve something that we haven't done in many years, which is actually raising money for projects. So this is called our Accelerator program. So let me pull this up. So the idea of the Accelerator program was, just a little bit of background on Center for Industrial Progress and how it works. The original conception, or at least pretty early on when I was deciding, okay, I was really thinking about how can I really help clarify energy and environmental issues, and also other industrial issues, but mainly I've been focused on energy. Like, what's an efficient business model to do that? And I had a lot of reluctance to be a nonprofit, because then your primary customer is the donor, and it's very hard to be connected with what's actually creating value. So I decided I think we should be primarily for profit, because we can write books and give speeches and deliver consulting, and that will really allow us to be focused on creating value. And that's a good way of making an impact in the world. And I still I still definitely believe that. I think being a for-profit business has been incredibly helpful in terms of just creating a lot of value and having a lot of influence. But at certain points in that progression, what we found is, hey, there are things we can do to accelerate our progress at promoting our ideas that aren't necessarily profitable for us as a business right now, but that could have a big impact. And maybe there are people who love our work who want to support it. So for example, and this is why we started the idea of becoming an accelerator. So I just have a list here of, historically, accelerators helped finance my first public debate ever against Greenpeace. Fun fact, Don was my first debate partner, and he actually killed me in that debate, which was very disconcerting at the time, but fortunately it prepared me for the real one. My debate with Bill McKibben, some of the crashing of anti-fossil fuel protests. We have given out thousands of copies of The Moral Case for Fossil Fuels to students and teachers. And also we got marketing support on The Moral Case for Fossil Fuels that helped to become a New York Times bestseller. And I think one of the most influential energy books of the last decade. So there have been these situations where, other people who really believed in what we're doing, they could see it scale more. They wanted to see it scale more. And it didn't necessarily make sense for us as a business, since we might not have the money to invest in it. But if others could help us invest, then it would help achieve their goals, and it would also help achieve our goals. And so this year we have 4 projects where we could really use that help. And then in particular, we could use that help a lot because of the current financial situation, largely in light of COVID-19, but also the energy industry is particularly suffering. So the big projects are, and you can see them on the screen if you are interested, but I'll describe them. So one is on political messaging. We want to provide revolutionary energy and environmental messaging for pro-freedom political candidates. There are lots of candidates at the state level, at the national level that we've talked to. They would love to support energy freedom. They don't have a large budget. Some of them have no budget now, particularly with the crisis. It's hard to get contributions, but they would really use the right messaging. And so I would really like to be able to pay for the team, including these other guys on the call, and other people, so to help us create really great messaging for them, so that pro-energy messages and policies have a greater chance of winning out. The second thing is national media presence. I've been a little bit behind the scenes in the past few years. I think it's really important to get out there and debate with people, to speak, to go on shows that are trying to attack me, so I can really show that energy freedom is good, that fossil fuels are good, that policies like the Green New Deal are ultimately anti-human. Telling the truth, I just think I as an individual can do a lot, but that requires a lot of time, and it requires some expertise. So we're working with getting a top TV booker and some other people to really help me speak out about these issues on a national level. And I should say, with all of these, by the way, 2 things about the Accelerator program. They're going to apply to this and apply to everything else. So for the Accelerator program, none of the money goes to me personally or goes to overheads. This is not like you're donating to Alex and then Alex gets to live in a nicer house or something like that. This is, I use this money. I mean, the 2 purposes are research and development, so to develop better stuff long term, and then also for promotion, to spread the ideas wider. And the primary thing we're paying for is to put together the team, both our internal team members, but also really high-level external people to do that. So when you're giving Accelerator contributions, again, it's not to me personally, it's not to overhead, it's directly to these very high-leverage people to accomplish these high-leverage goals. So the third one, and this one is, we'll have to replace it with something else if the COVID stuff continues too badly, but is speaking and debating at leading universities. The nation's universities are right now a hub of just anti-fossil fuel activism. I had a lot of success last year speaking at a couple high-profile universities, but I really want to take on all comers this year, tape these things, live stream them, promote them, because I am so confident that I'm right about this, that the world needs more fossil fuels, not less. I don't think anyone at this point can really refute that case, but we need to get that case spread. And so by supporting these kinds of efforts, you can really make that happen. One more thing I should say about the Accelerator program and our efforts in general is that becoming an accelerator, you'll see there are some really cool rewards associated. But one reward you do not get and that nobody gets is to in any way dictate our policy. So it's not that like, oh, you become an accelerator and you get to say, oh, here's what you should say about coal, or here's what you should say about gas. No, nobody has that kind of influence at all. I don't think anyone has even asked for it, but just so you know, that's not, so we're not bought or something like that. And we set things up so that we don't need the contributions to exist. They accelerate us so that even like nobody can have the pressure where, oh, if we pull the plug, then you die. So it's just really important for other people to know that. But also if you were thinking, oh, I can manipulate you guys into promoting my position if I give you money. No, if you believe in what we believe and what we're doing based on our track record and what we say, then you should definitely accelerate if you have the means to. And then the final one is the moral case for fossil fuels 2.0. And there are a bunch of aspects to this. So many of you know I've been working on this project for a long time, longer than I expected, probably longer than you expected. And the reason is because I found that with the moral case for fossil fuels original one, that was an incredibly good use of my time. It's influenced thousands, I mean, I think ultimately hundreds of thousands, arguably millions of people. And I always think every minute I spent on making that thing effective was really worth it. Well, it's been 5+ years since then. I've learned a lot. I've learned a lot about how to frame arguments. I've learned a lot about the facts. I've learned a lot about how to tell stories. I've learned a lot about how to simplify arguments, make them more retainable. And so what I'm thinking, this is supposed to be the ultimate explanation machine to explain to people why fossil fuels or hydrocarbons are crucial for the future of human flourishing. So we're investing a lot of time, a lot of money, including bringing in some amazing experts to just create the best possible product, because as good as the original moral case for fossil fuels was at influencing people, like it wasn't nearly good enough. We have not influenced nearly enough people, but I believe with a book that's 5 times more effective, we can really change the game. At the same time, so that's expected to come out next year. We definitely finish it this year, and your acceleration helps with that. But we're also going to create a moral case for fossil fuels in 2020 essay that's directly focused on the 2020 elections. And you're seeing today with COVID that the right essay at the right time can have a profound impact. So that's another thing we want to focus resources on. So those are the 4 big projects. At some point, who knows, this COVID thing may be another project, but these are integrated projects to just really impact the energy policy debate in this crucial year. And I know it's a very difficult time for everybody, so I have no hard feelings at all if you're unable to contribute. But for those of you who are able to contribute, I just want you to think that this is a really decisive year. Some of the worst energy policies ever proposed are on the table. The fossil fuel industry is just totally under siege, and there are very few people who can tell the truth about this. And you should not just, you should care about this if you're in the fossil fuel industry, but you should care about this just if you're an American or if you're a citizen in the world, because these bad policies would be really bad. But if we continue to have generally good energy policies and we improve them, that's going to make life better for billions of people. That's going to lead to a continuation of the progress that just makes every year overall better than the last. Or even when we have a down year like we seem to this year, at least we have a lot of sort of reserve ability to survive. So that's the impact that we want to make. And just a couple quick notes about the different rewards. I'll just run through them quickly. So there's a whole bunch of different levels of this, and then you can also give custom contributions. And by the way, the website is industrialprogress.com/accelerate, industrialprogress.com/accelerate. So I'll just run you through them quickly. I mean, it just ranges from, if you want the I Love Fossil Fuels pin, which you may have seen me wear, you'll get 5 of those when you contribute $25. $50, a signed and personalized copy of the moral case for fossil fuels. $100, any energy or environmental question you can get answered by Don and Stefan, the CIP research team. If you're a $250 accelerator, you can get any question answered by me on Power Hour or the Human Flourishing Project. And now these other ones are at the higher levels. What we're really doing is if you contribute at these levels, what we're actually offering is it amounts to like significantly discounted prices on what we would normally charge. And so part of the reason is we want to encourage you to do this, but also part of the reason is that we're at a very abnormal time in terms of our business, because so much of how historically we've supported our projects and our ambitions is through public speaking and doing high paid public speaking. My usual rate is 22,000 plus 1,500 expenses. Like people, will pay and they think it's really valuable, and we're glad they do. Like $23,500 to bring me in to speak. Well, COVID, there's no more speaking, so that means hundreds of thousands of dollars, that we would normally get and be able to put toward these projects, we're not getting. So I believe in adapting to changing conditions, not just saying, well, I wish it were the same way. Think about how do we make it worth people's while. So one thing to make it worth people's while is just to see, okay, now if you contribute to our Accelerator program, then you can get, and so there are a couple of things. There are some things you can do virtually now. So if you're $1,000 Accelerator, you'll get a 1-hour coaching or consulting call with me, and that can be any topic. And that's usually something that we charge $3,000 for. A virtual speech and extended Q&A, that's something we usually charge $5,000 for. You can get that for $2,500 contribution. And then a live speech, you might say, well, I don't want that. But what we're basically saying is that if you contribute $10,000, then at any point in the next 2 years, anywhere you want me to speak, I will be there. I'll pay to be there. You just pay the $10,000. So it's a very significant discount. I hope that the rate doesn't go that low ever in the future once things resume. But if you really, if you value our mission and you think you might want to have me speak at some place in the future, then this could be a great option. If you value our mission, you don't have a place for me to speak, we'll pick a place for you, whether it's a leading university or an organization of your choice. And then finally, you can contribute more than this, but at the $25,000 level, you get as your reward for that an all-day consulting session, and that can be any topic. It can also be a coaching session. We'd have to discuss the specifics of that in terms of what you want. It could be multiple speeches to different groups. If you want any details on any of this, it's alex@alexepstein.com, and feel free to ask me. Just a couple of points of fine print so that I guess I should just say again, industrialprogress.com/accelerate is the website. So that contributions to us are not tax deductible for a whole bunch of reasons. I think we are much more effective with money, even if you account for non-tax deductible ability, than most nonprofits. You'll have to judge that for yourself, but just so you don't get, in trouble with the IRS, you don't get any tax deductions. So I want to make that clear. Also, if you happen to want one of the rewards at a lower level, feel free to ask for that. Each of these rewards goes with just the dollar amount that you contribute. It's not one of those things where you get all the rewards below. So if you want a different reward, then you can just separately contribute that amount, or you can always ask for a lower reward. Just want to make sure that we're totally transparent with you. So again, I think that I know that for everybody, this is a really hard time. If you never give us a dime, but I'm just always so grateful for the amount of support that we get. And I love receiving your emails, even if I'm not always the best at responding. But I know that there are people in this audience who have had a lot of success and who are still, I know I can't say anything about anyone's position, but like, this is something, certainly that we believe in, that we invest our time in. And if you really believe in what we do and really want to see this scale at the right time, at this crucial time, again, when the industry is under siege, when there are so few defenders, when there are people out there, politicians who want to support the industry but can't, if you want to see more of that, I think this is a great investment, and I hope the rewards make it that much more worthwhile. So once again, go to industrialprogress.com/accelerate. Okay, wow. How long have we been going? It is over power hour and a half. It is now power hour and 40 minutes. Thank you to Don Watkins and Stefan Henna for joining me this time. It was great to get your guys' input, and it's good to have this companionship. Very interested in what the listeners or the new viewers think of this format. If you don't like it, feel free to tell us. If you like it, feel free to tell us. Just to wrap up, if you have any questions, comments, love mail, or hate mail, you can email me at alex@alexepstein.com, along with any ideas you have or any contribution you're willing to make in the intellectual sense in terms of the vision for COVID-19, this idea of don't stop living. live smarter. That I'm really interested in. And then, of course, if you have any questions about the Accelerator program or rewards, feel free to email me directly at Alex. So that's email me at alex@alexepstein.com. All right, this was a fun one. There's lots of, unfortunately, it's precipitated by negative events, but it's still a pleasure to get the opportunity to try to clarify these issues for everyone who follows our work. If you think there are other people who should follow it, please share this with them on YouTube or somewhere else. And one more thing is, make sure, if you're not on it already, get on the mailing list at alexepsteinlist.com. That's alexepsteinlist.com. All right, that's it for this week. We'll be back next week with a lot of topics, probably a lot more COVID and, unfortunately, more green energy schemes and scams, but hopefully some inspiring stories and some stories of progress as well. Thanks for listening or watching. Until next time, I'm Alex Epstein. This has been Power Hour.
Power Hour. Life, liberty, and the pursuit of energy. Power Hour. The antidote to shallow thinking about energy issues.